Welcome to my channel. If you are a passionate body worker, you will find the best tutorials here. I am Ulf Pape from Germany. I have been working as a lecturer in physiotherapy, massage, and osteopathy for 25 years. This tutorial is about treating the sacrum. You can also use these maneuvers to release iliosacral blockages. Now let's get started. Place your fingertips on and next to sacrum. Apply acupressure and move the sacrum. In addition, you cycle your fingertips to left and right. Change the position of your fingers after few seconds. This combines rhythmic acupressure with mobilization. Also include mobilization of the lower lumbar vertebrae. On the next maneuver, your fingertips melt up, over, and under crista iliaca in the direction of the spinal iliaca. Then perform the same maneuver with the fists. Now gently smooth out of the area with your palms of your hands. On the next sequence, you put on the fingers, like in the sequence as before. You ask the patient to move into the pressure in many different ways. The patient raises and lowers the pelvis. The patient moves into the fingertips from different angles according to their abilities and needs. In the following sequence, the patient moves into the child yoga position. In the stretch state, your fingertips slide into the myofascial tissue in an acupressive manner. Further points are located on the sacral edges and on the lower transverse processes of the lumbar spine. The coccyx muscle is also important. Carefully place your thumbs under the coccyx. You should also press directly over the sacralic joints. Now instruct your patient to straighten up vertebra by vertebra and continue treating her as before. All movements and techniques should be performed very slowly. Then tell your patient to go back to the child position. You can perform this maneuver several times on the treatment. Now you instruct the patient to return to the prone position. Now in the third sequence, you do the same maneuvers as in the first. Start with the palm steps. Go up and down with the alternating pressure. Then apply alternating pressure with your fingertips again. Change positions and instruct the patient to move into the pressure again. Now you will both notice that the movement of the sacrum is much easier than before. So much for the sacrum. In the next tutorial, we will treat the rest of the spine. We will proceed in a similar way to this tutorial. We start again with passive manual techniques, then we integrate active movements and treat in yoga positions. My treatment strategies are based on therapeutic creativity. There are syntheses of application and care. I try to make clients aware of their needs for touch and movements. I have been following this successful path for almost 30 years. The number of enthusiastic clients and students increases every year. If you like, I would be happy to inspire you for your path as a therapist. If you have any questions, I will be happy to answer them. I recommend that you subscribe to this channel. I hope you enjoy learning. Thank you for your attention.